sector of the regenerative medicine, the growth is being expected. If you see, the sector is regenerative medicine. And Dr. Desai was talking about drug development assays. Again, that is also a major one. So if you look at that one, see here, real opportunity here is regenerative therapy, proprietary stem cells, and drug testing and discovery. This three alone is going to make the entire gap here. There's lots of gap. As the development comes in, this is where the real opportunity is there in 2016. So this is for the corporate thing. Suppose if you wish to go on, there is a, just would like to tell you, just go ahead, because globally there is a projections. You see, I am not talking about in India. There is a less stringency as well as less resistance to stem cell therapy is there. I'm talking about it from the places where EU and US were resistant to ESL, I mean embryonic stem cell therapy is very, very high. Even there the projections are this. So if you're going for autologous, then the things will just boomerang. It will go up very, very high, provided the technical things matches with this. Now, regenerative therapy again, if you look at the markets here, I'm talking about new stem cell treatments alone is coming around 7.3 billion in 2014. So I'm just giving you the market rates because to tell you that it is not that only India is there. The countries across the world are really eyeing on it, and that's what important. And thrust areas here is look at it: autoimmune disease, diabetes, oncology, cardiovascular, neural, it encompasses everything almost. Bioartificial livers. You have dermatology, adipocyte stem cells, and regenerative dentistry. Already dental stem cell baggings have come. So they are trying to use the dental stem, whatever stored, for their different uses. So all these thrust areas of regenerative therapy are, these are designated ones that have been used, that have been identified. Look at the cancer alone. We have 859 million is the value at 2010. Probably it cost more than $1.5 billion. See, let me tell you, as far as the stem cell therapy is concerned, this is not the anti-cancer stem cell therapy. Stem cell therapy, since I have worked on this area for almost 15 years, I know the cancer can be tackled in a different. Add insulin-like growth factor that promotes the CXCR4 expression in the bone marrow and change it. So a laboratory person can change or tune to the according to your needs. For example, I have got only bone marrow, but I have to treat a particular injury there. Well, it could be done. Change the entire expression pattern. Change the expression pattern in the HSC. The CXCR4 is present in the cytoplasm. It won't come to the surface unless you induce it through insulin-like growth factor. So these are all technical aspects that you have to do that, and then it can be used. But otherwise, the bone marrow will not go there. It will never goes there. So that's important. And proliferative capacity I talked about already. Again, it's long is going on, but anyway, people now have found that how am I going to attract the cells? You see, body also has natural healing mechanisms, natural healing processes. How am I going to do? Impregnate even a small scaffold with the impregnated cytokines. For example, sonic hedgehog, neurotrophin, platelet growth factor. These are going for neuronal differentiation. Take the fibrin scaffold, impregnate these, place it, or even during the surgery or something, just put it over there. Our body cells are not naturally going to stay there. It's going to go there. It is not that you have to isolate the stem cell and inject at that particular spot now. You can, same stem cell therapy only, you are using the same principles of stem cell therapy only. Every organ has a regenerative capacity. Where it comes from? It's natural stem cells. You augment the process, that's all. You speed the process. Similar things. It could be anything sometimes they mix it also. They place it, and again stem cells also were impregnated and put in for a speedy recovery. So many things are there. TGF beta usually for chondrocytes and others, osteogenic DLL4 or ciliary neurotrophic factors for neuronal differentiation, or bone morphogenetic protein for bone regeneration. So anything that you do that can be used. Now again, as I talked about MSC homing, CCR9 expressing one stem cells are going for intestine, I discussed previously also. CCR1 is going for inflamed tissue, CXCR4 for damaged tissue. So what happens is, if a stem cell expresses CCR9, you can use it for intestinal disorders. For example, you can go for inflammatory bowel diseases. You can try to do that. If you're going for CCR1, inflamed tissues of rheumatoid arthritis and multiple sclerosis in the brain, so you can use it CCR1 expressing MSCs. So either you augment the expression in the lab, or you take the source of the stem cell that expresses these, then it will give the good results. So the thing is that it is a combination of all things that gives, not only physician part, scientist part, individually they cannot do. They have to come together, then only it will give the very good results. So again, cord blood. Again, there is a huge problem. There is a lots of cord blood they store, and they do indiscriminately. They use it for the different things. Okay, they say cord blood is a good, very good. HLA mismatch. There is a 4/6 match is sufficient for cord blood things, transplantation. They used to say 4/6 is okay. It's equivalent to 10/12 of the adult one. But 4/6 match, where that 4 comes, that's important. If we say HLA-A or DRB mismatch on overall surface is more marked than the mismatch at HLA-B and C. So while you are choosing the cord blood itself, you should be very clear what cord blood you are using. We have maybe of the 1 in 10,000 maybe a match, but in India nobody is doing the HLA typing at all, not much. But even if the HLA typing is being done, again there are a lot of strictures are there. Mismatch at HSC is well tolerated in Japanese population, but not in others. That means even the HLA makeup itself is playing a role here. Even ethnic things are different. So every ethnicity it will differs. Again, HLA DQ mismatch alone it won't do much, but in combination of others it will become very high. So again, KR incompatible donors is enhanced over. So in fact, KR is it's not a real HLA, but it's a comparative, another one associated killer related immunocompatible things. So these things, if they are mismatched, it will be useful for cancer patients. So even especially in the ALL and CML, again I'm telling, and even in the cancer cases, HLA-C mismatch is beneficial in ALL but not in CML. HLA-C. The reason, I don't know what happens, so maybe the environment, the niche itself would have been changed by the CLL type. So the HLA-C mismatch is good for ALL but not for CML. So the cord blood transplantation alone, if you see. So that tells you clearly that these are actually the real results. They have got it from the just random infusions of the cord blood. So when they were not random, they got the 4/6 match, but they injected, they got the adverse results. In fact, they are not supposed to get, but they are getting the adverse results. These are real human things that these should be nourished, and it should be used, and could be used for future things, and that is more important here. So thank you. Is there any question here?
Guidelines and how clinicians can deal with them. Now I want to welcome our next speaker, Dr. Pradeep Mahajan, who is an emerging personality in the field of regenerative medicine.
Medical practitioners seeing here under one diagram to look for the future of medicine. This evening we'll have a feast of knowledge on regenerative medicine, which is coming in the future for you, as a feast of good food. A blender taste we'll taste today. Today's my outline talk will be starting from life expectancy, where the evolution of medicine has taken place, and where in future we are going to go with the cellular medicine therapeutic applications. If you see, to introduce to the subject, limitations of proven therapies. We all doctors know, we have been practicing medicine, some of them are 10 years, 20 years, 15 years. Everyone might have come across to say his patient, In some cases, yes, I cannot do anything. You have to live with the disease and to lie with the disease. When you say this, it's really painful. He comes to you thinking that you are going to make him better. But when we know the limitations as a medical profession, with the proven therapies where we cannot do anything beyond, we need to explore what are the other avenues, what else we can do. This was a big question in my mind running for a long time. And this took me to the research part of cellular medicine. I would say rather no longer medical services has remained the domain of physicians and clinicians. When we understand there is a limitation for our knowledge and application of that knowledge to therapeutic purpose, we should accept that addition is required for the further to take the subject. We need to incorporate ourselves, integrate our theories, clinical knowledge with the researchers in biological science. We cannot forget, if you see, as Dr. Anand said, in some of the areas where incorporation of scientists and researchers in biological science do help to treat these incurable conditions. Even physicists, electromedicals also, telemedicine which is coming in future, physicists which have given a lot of diagnostic tools to us, like from MRIs to many of the diagnostic machines like CT scans, X-rays. We can never forget a combination of these different specialties, give a blender test to find the new subjects of therapy. When we join ourselves with research medicine, regenerative medicine, I hope we can create wonderful protocols which can treat incurable conditions. What we declare today, we cannot do anything. Now, if you happen to see life expectancy when it started hundreds and thousands of years before, when people believed sanitation was not at all a concept to be followed up, people were superstitious for any kind of treatment also. People lived a short life, not more than 30 years. The process of evolution was going on all the continents, not only India. Then the India was developed, but the Europe and American continent were not that developed. When we go to middle age, where real evolution started by antibiotics and vaccines coming in picture and people realizing the value of sanitation. These three things took the life expectancy beyond 40 years and 50 years. This was also a short period. And when we look around the story of around 200 years before, where we use antibiotic vaccines, but we were not knowing how they are acting. We just got the fruits of it. But the real research started in the last 50 years, where we really learned how antibiotics act, vaccines to play the role in the therapeutic purpose. And with the recent added new researches, life expectancy has gone to more than 70 years. And what I look with the coming future of applied cellular science to the subject, life will be ageless, and that too, healthy lives. When we visualize this medicine for the next 100 years, we have to coordinate and understand what are the other sciences of medicine which are equally growing as per cellular medicine. Let's visualize next 100 years what's going to happen in the medicine. This is a wonderful experience to know. It's not only the cellular medicine or the regenerative medicine is growing. At par, other sectors of medicine are also growing with the same speed. We specialize in one subject, we think that is the only subject is growing, but it's not like that. The other sectors are also growing equally to visualize that 100 years, what is health industry going to be or health medicine is going to be. If you see robotic medicine, initially simple robots came in. Then robots were used with minimal invasive surgery to minimize the trauma. And now intelligent robots, autonomous robots are coming in, wherein MRI technology integrated with the computers or softwares. This is one which is going to exploit the world of robotic surgeries, where you are at one end of the world and you can do the surgeries at other end of the world using satellite technology. Eye knives in cancer therapies or cancer surgeries vaporize the tissue without any scar formation. In telemedicine, we all are using Skype as an internet facility to have remote consultations. But this is not the end of telemedicine. Telemedicine is growing in every sector. If you see, virtual consultations are being organized nowadays. Not only that, satellite operated, I told you, robotic surgery, the diagnostic procedures are done, or virtual diagnostics like colonoscopies or endoscopies are done with telemedicine. The recent invasion of 2014, in May, the one wonderful research is coming is of Google Mirror. Google Mirror has revolutionized the medicine so much so further. You can visualize the doctor in your bathroom also. A mirror integrated with the software and using the sensor technology, holographic consultations you can conduct. You can go for virtual diagnostic procedures. This is one area which I could demonstrate you how Google Mirror is revolutionizing the medicine. Pointer. Now you can see the way diagnostic procedures are done with Google Mirror. The mirror is scanning the entire body. The mirror is scanning in different sectors of the hand. The entire data of the body can be mapped out and memorized. Medicine iPhones can be used as diagnostic tools, carrying the data of medicine from patients. You can have consultations, you can follow wherever you go the patient's records. Visualization of histopathology. This is one area which is coming up in visualization of histopathology, where multiple diagnostic slides are there which are digitalized of each organ specific, each disease specific. And you no more require pathologists for diagnosis. Even if the areas where the pathologist is confused, you could use this computerized software where it can give precise diagnosis using this digitalized histopathological data. Then artificial augmented limbs using brain chips, using at motor cortex, the limbs can be augmented as normal functions. This has changed the dimensions to understand disability. Let's see cancer. Once upon a time, cancer was a big dreaded disease. Now if you see, it's no more a mystery. We have come to the conclusion there's a gene called as cancer gene, which is very important to know, to have a cancer gene, whether it is coming of familial tendencies or it is come by mutation, but the gene has to be there in the cancer cell. Now, whenever the clinical presentations we see nowadays by proven therapies and proven diagnostic tools, we get the patient when clinically presentable with signs and symptoms. That time we say it is too late for you to get treatment. The recent science has brought in the best diagnostic tool is DNA chip. This DNA chip is a small gadget. If you suspect or if your family history, suppose somebody suffers from a CA breast or their family there is family breast, if you can screen the breast every 3 months, 6 months with the DNA, just move this DNA chip on the breast. It can detect the cancer gene at that level, at a cellular level, where the cancer colonies are not formed. You can imagine the technology is going to eliminate the cancer once upon a time is a dreaded disease. Once you can detect at that level of cellular level by using DNA chips, we should also know the technology which can treat the cancer at that level. The therapy which is coming for this is in not far off, maybe another 2 years it will take, using nanotechnology, where magnetic nanoparticles can be attached to chemotherapy molecules, and these molecules will take specific to those cancer genes only and destroy those specific cancer cells. Similarly, you can use cancer antibodies, again attached to those nanoparticles. Those will specifically go and attack the cancer cells. You can imagine what will be the future of cancer if we can diagnose at a level where the cells are affected, not the colonies are formed. Cell-based therapies like DC cell, dendritic cell therapies, T cell therapies, NK cell therapies, these are immunological based therapies for cancer cells or cancer diseases. These are also coming up. This is a proven therapy. Presently, a lot of cellular therapy centers have come in Middle East, in US and Europe, as well in India. We at our center also are doing cancer cell therapy using DC and T cell therapies. Genomics and molecular medicine. Once you talk of genomics, we should understand what is genomics. Genomics does mean gene as a software of a cell, and protein is a hardware of the cell or that organ. If the software is faulty, the organ is going to be faulty. The genetic engineering plays a major role for the software to improve. We can use vector technology and transcription factors to change the genetic characters here so that most of the genetic diseases can be treated. So it's a complex, mixing all the therapies like cellular therapy, using genetic therapy or molecular therapy. You can treat many of untreatable conditions. Nanotechnology, as I told you very well, in cancer treatments or metabolic diseases or genetic diseases. This was a slide to just compare a man-made machine and a natural nano machine which the God has made. What are the functions of cellular parts equivalent to the man-made machines? When we have seen the different sectors of health going on, my today's main talk was cellular medicine. I wanted to take you to that journey only for one reason. All sectors of medicine are moving at same speed. One, if understands the integration of making all these subjects together, you can treat almost all untreatable conditions. The first major revolution, it's not the science fiction, it's the stem cell research. This was proved in 2000 when first embryonic cell was used for not therapeutic purpose, to clone. Dolly the sheep was produced. That was a time where applications of stem cells, particularly embryonic, thought of to apply into clinical research and therapeutic purpose. There was a big hype. He was the first person, Dr. Gordon, who developed this technology, was awarded with the Nobel Prize. Before we go ahead of the subject, I would like to tell a small story. Any one of us can imagine when you go to your doctor and your doctor says to you, you are